progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
If you have a chronic non-healing wound, the staff at the Center for Wound Care and Hyperbaric Medicine, a program offered at Palmdale Regional Medical Center, can help you get back to the activities you enjoy. My guest today is Dr. John Gambol. He's board certified in undersea and hyperbaric medicine and a member of the medical staff at Palmdale Regional Medical Center. Welcome to the show, Dr. Gambol. Just tell us what conditions would typically cause people or contribute to wounds that don't seem to heal.
Wow, that's a broad question. There are literally probably a multitude of things that'll keep wounds from healing. I think overall, probably the biggest risk factor that we can look at is probably diabetes and anything that leads to hardening of the arteries. The same risk factors that cause stroke, heart attack, can also lead to poor circulation in the legs and lead to non-healing wounds. I think that's probably the biggest one. I think you got to throw in there anybody that's had any kind of cancer treatment. Chemotherapy can lead to wounds that do not want to heal. Any radiation therapy for patients that had cancer. And then any underlying immune process, people that have different types of like rheumatoid arthritis or lupus. And that probably is the vast majority of the patients that we treat at the Wound Care Center.
Some people have wounds that take longer to heal. When is a red flag that says this has gone on long enough?
Well, I think a general rule of thumb, which is good for anybody to look at, if your wound has not improved significantly in about a 2-week time period, then that's about the time that you should start thinking about seeking a more advanced type of wound care. And even earlier than that, if you have like warning signs of infection or if you're a high-risk person. And that would be things like if your wound is very red around it, it smells bad, you have fever, or you're a high-risk patient because you have diabetes, you know you have blocked arteries, or you have underlying cancer or those autoimmune problems that we talked about earlier. And if you have any of these red flags, then definitely you should see your primary care physician, go to the emergency department, or see a wound care specialist before that 2 weeks. But definitely if something hasn't improved in 2 weeks, that's a good time for advanced wound care.
Are there certain areas of the body that are more susceptible to these types of wounds?
Definitely. A high percentage of our wounds, probably 80% or more, are on the lower extremity, from the knees down. As you get further down the leg, foot, ankle, and your big toe, you're moving further away from the heart. So that is an independent risk for a wound not wanting to heal. But again, wounds can happen anywhere on the body. It's just the foot and ankle and lower leg area are the highest risk locations on the body.
If somebody is noticing some of these symptoms you're describing, what's the first line of defense for them to take care of that wound?
Well, I think standard, good hygiene, making sure a wound is clean, make sure you keep it covered are probably a good common sense place to start with. And then, again, if you have any concerns, someone has a wound that they think is high risk because it's red or they have a fever or there's just any concerns about it, they can always check with their primary care physician. Urgent cares are always a good option. And then, of course, last resort, if you're really concerned and need to be seen now, the emergency department is always a great location to seek help. And if someone has a wound and they know it's not going to heal, they're always invited to make an appointment at the center, and we can always evaluate anything and determine what needs to be done to help a wound heal.
Is there any truth to the myth that air heals wounds? Do you like everyone to keep their wounds covered?
I'm an oxygen specialist. It's my specialty is using our hyperbaric chambers to heal certain things, and all the oxygen you need to heal a wound comes from your blood. Leaving a wound open does not help a wound heal, and in fact, there's many studies that have been out for many years that show that if you leave a wound open and uncovered and dried out, it's actually going to take longer to heal, and it's going to be at a higher risk for infection.
That's a great tip and really good information. So what treatments are available for non-healing wounds?
Again, I think the amount of treatments are as varied as the type of wounds. We do all kinds of things to help heal a wound along. Most commonly, we look at what's causing the wound not to heal. We address the underlying problems, really focus on getting people to control their diabetes. And then when it comes to advanced wound therapy, there's several different surgical techniques we use to help heal a wound. We use several advanced dressings. We work on different types of compression therapy to help control the swelling, as that may keep a wound from healing. We have special casting techniques we use to help keep pressure off a wound. There's several different advanced wound care products, all the way up from collagen dressings to advanced artificial skins that can almost mimic human skin.
Tell us about hyperbaric oxygen therapy and how that can help chronic wounds.
Oh, that's one of my favorite topics. I have seen hyperbarics heal things that other modalities will not heal. All the things that hyperbarics does is very complex. But basically, the long and short of it is it helps grow new tissue into a wound area. It actually stimulates a process called angiogenesis, which means while undergoing a course of hyperbarics, your body will actually grow new microcirculation. You'll grow new microcapillaries and blood vessels into a wound area, which helps a wound heal. Hyperbarics also will help stimulate your body's immune system to help fight off infections. It directly kills certain types of bacteria, and it also enhances the effect of many of the antibiotics that someone may be on. It'll strengthen the antibiotics. And that combination it's amazing to watch a body part or a wound that is infected or at high risk for needing an amputation, that hyperbarics will often improve that condition and a lot of times prevent the need for more aggressive surgery or an amputation.
What can patients expect during hyperbaric oxygen therapy?
Overall, it's very, very well tolerated. It's one of the safest procedures out there. Almost no contraindication to a round of hyperbarics. About the biggest thing people feel is sometimes they'll feel their ears squeeze a little bit, like if they're flying in an airplane. And aside from that, they really don't notice much of anything else.
Then really, how long after they've had it can they see results from it?
Again, it varies, but on average, it depends on what we're treating with hyperbarics. But usually, a patient will start noticing significant improvement in around a 2-week time period. And then, depending on how severe the wound is, they may need hyperbarics for anywhere from 1 to 3 months, depending on how severe the underlying problem is. But usually it takes about 2 weeks before you start noticing a difference in the wound or the drainage or the infection load with the course of hyperbarics.
And how long is the session?
An average session, we say it's a 90-minute treatment session, but by the time you get into the hyperbaric chamber and get pressed to depth, usually takes about 5 to 10 minutes. You're at depth for 90 minutes and 5 to 10 minutes up. So we usually tell people it takes roughly around 2 hours or so for a hyperbaric session. And a patient undergoes that daily, Monday through Friday, for, again, depending on how their wound is responding, 1 month to as long as 3 months.
And are there certain people that you want to keep an eye out for wounds? Sometimes people bump into things and don't even notice, or they get little bruises. Is there something you want them to look for? Should they give themselves, like they would give themselves a skin check for skin cancer? Do you want them to be looking over for wounds?
Well, I think that especially if you're diabetic, it's recommended that diabetic patients check their feet almost daily for wounds. It's definitely, we recommend daily foot inspection, especially their bottoms of the feet and between their toes, and which can often be difficult because a lot of patients cannot, see the bottom of their feet. So in that case, we recommend that they figure out how to get some kind of a mirror, and definitely with the diabetic foot, diabetic patients with any prior history of foot ulcers or even diabetics that have not had problems with their feet, it's a good idea for them to look and inspect their feet daily for any wound development.
And in just the last few minutes, Dr. Gambol, what should people with chronic wounds be thinking about?
Well, they should, I think it's probably true for any wound, not just a chronic wound. They should think about how long am I going to have this wound? What can I do to get it to heal faster? And what kind of risks do I face if I leave the wound open or this wound does not heal? I think that, especially for the chronic wounds, the longer that wound is open, the higher risk they are for getting some kind of complication, a more serious infection, an infection that could, potentially lead to some kind of surgery, or an infection that could lead to some kind of thing like blood poisoning or a bad systemic infection.
And why should they come to the Center for Wound Care and Hyperbaric Medicine at Palmdale Regional Medical Center?
Well, I think the physicians that are on staff, besides myself, as well as the nurses here, we have vast experience dealing with all the strange wounds that do not want to heal, as well as the routine wounds that don't like to heal. And we have a high success rate of getting our wounds to heal. And we're really good at figuring out all the little intricacies and all the little issues that come up in people's daily lives that tend to get in the way of following a wound care plan. And we do things that some physicians may not have the ability to do or the access to certain techniques, and we have a good track record. And I think we also have a high patient satisfaction. Most of the people that come through here like what we do, and if we find that if patients have a recurrent problem or a new wound at a different site or something, that oftentimes that they call us right away and get in so we can take care of their second wound as quickly as we took care of their first wound.
Thank you so much. It's really great information and so important. Thank you, Dr. Gambol, for being with us today. You're listening to Palmdale Regional Radio. For more information, you can go to palmdaleregional.com. That's palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. This is Melanie Cole. Thanks so much for listening.